Assalamu alaikum. Welcome our Malaysian student in the second part of our important lecture about pesticide. I hope that you enjoyed the first lecture and studied the lecture. So can we continue in the second part of the lecture? Also, I know this is important pictures for you in Malaysia. Okay. Four patients came to Tanta Poison Control Center after spraying of parathion. Parathion is a member of organophosphates. The first one of the patients complained of excessive diarrhea, vomiting, and blurring of vision. Second has pulse rate 110, tachycardia. Third, severe cough. And the fourth was asymptomatic. Okay, so the first question is the explanation of each person. So the first, what is the cause of excessive diarrhea, vomiting, and blurring of vision? Second, what's the cause of tachycardia? Third, what's the cause of severe cough? And the fourth, symptomatic. Why this difference between picture? Why the variation of this picture? Please discuss this case with each other, and you can communicate with each other, and you can refer to the lecture, and you can to communicate with me through my mobile phone or WhatsApp. Okay. In case of organophosphate, if it's symptomatic, we start atropine therapy. If asymptomatic, we can observe for 12 or 24 hours, or we can do atropine challenge test. We induce atropine or a patient of atropine, which is normally induced tachycardia. If it does not induce tachycardia, this may mean that the patient may have a hidden or a mild case of poisoning. Okay, okay, this, I know this food is famous for you, and one of your previous colleague in the previous batch brought to me one dish. Okay, so enjoy eating this delicious food for you. Okay. An adult female with organophosphate poisoning come to Tanta Poison Control Center, received atropine and improved, discharged from hospital. 2 days later, she came with weakness of muscles, neck, and inability to move shelter. What is the explanation and how can be avoided? This case is called intermediate syndrome. What is intermediate syndrome? If the patient is not treated properly, there will be permanent inhibition of cholinesterase enzyme, leading to aging of the enzyme, and the patient complain of nicotinic manifestation in the form of weakness of muscle and mostly muscle of the neck and the upper chest. So he can't move muscles of neck or move his shoulder. So the explanation is intermediate syndrome because he didn't receive the proper treatment. How can be avoided? Avoided by proper treatment. What's the proper treatment in that case? The proper treatment is to take oximes or cholinesterase reactivator in addition to atropine. And oximes has to be given in early in poisoning before maximum 18 hours. Why? Okay, as I hear from you, due to avoid reversible inhibition of cholinesterase enzyme. Okay. Organochlorine is the second type of organic synthetic insecticide. Nowadays, it's banned in most countries because it has a persistent effect. It affects nerve impulse transmission, may induce myocardial irritability and arrhythmia, and may induce hydrocarbon pneumonitis due to the solvent, the case of organophosphate poisoning. But the main problem of organochlorine is the persistent in the soil. So organochlorine is classified in toxicology into a group called POP, P-O-P. P. Persistent organic pollutant. The persistence of organochlorine in the long run can induce hepatic and renal injury. So this picture tells us that use of organochlorine, although it may induce abundant crops, this picture and this and more agriculture product, but as you see here in the form of the skull, so it may carry hazard inside it. In the other side, these trees that not used organochlorine is more healthier than that. Okay, and we unfortunately we can protect ourselves, and so this pest till that person, do you also eat this with that mask on? Okay, that's to tell him that you can protect yourself from traces of organochlorine present here. You can protect here from spraying, but unfortunately we can protect your food because you can't wear a mask that protect you from the hazard of the food containing organochlorine. Okay, so there is an organic product, nowadays organic product, because to protect ourselves from the hazard of these serious and severe effect of organochlorine and different type of pesticides. Okay, pyrethrins. Pyrethrins is among the natural insecticide. I told you in the start of in the first part of of our lecture that we have synthetic insecticide and natural insecticide. Pyrethrins is among natural insecticide, and I told you nowadays most developed countries coming back to these types because it has low risk. It has low risk. It's naturally occurring. It has direct irritant effect and hypersensitivity. The main problem is the irritant effect and the hypersensitivity. So the presentation of exposure to pyrethrin may be in the form of hypersensitivity reaction, may be in the skin rash, may be in the form of bronchial asthma, may be in any form of hypersensitivity reaction. So, ingestion of large dose may induce convulsion and coma, but this so the treatment measures are non-specific as any type case of poisoning, airway, breathing, circulation, and supportive measure. Okay, here in Egypt we have one important pyrethroid is called lycite, so used to kill lice. So this case, 3-year young girl came to the hospital with her mother complaining of chest tightness after using lycite. What's the explanation of chest tightness? True, true. Chest tightness here is an presentation of allergic reaction and irritant effect. But in the case of organophosphate poisoning with the cause of chest tightness, very good. The bronchospasm and bronchoria due to the cholinergic crisis, or excessive accumulation of acetylcholine. And in case of organophosphate poisoning, we control chest tightness and bronchospasm and bronchoria through very good atropine and oximes in the early stage, very good. But here in case of lycite or pyrethroids, chest tightness is treated with the anti-allergic drugs and corticosteroid. In that case, if we given the patient atropine, the person will get no benefit but will have the risk of atropine poisoning. So take care if you are the person exposed to that type of insecticide. Please proper diagnosis of the case and proper treatment of the case by anti-allergic and corticosteroid, and avoid to give the patient atropine. in the day, in the night, and in the light. Okay, so let us go to the herbicide. And as I told you in the start of the lecture, that herbicides is an important case of poisoning in Malaysia. If you search through the net, you will know that herbicide has instance of high instance of poisoning in Malaysia. Paraquat is highly toxic. It's absorbed through GIT, and fortunately, alhamdulillah, absorption is more through skin or inhalation. So, if you are present in the farm during spraying of paraquat, it will not be absorbed by skin or inhalation. It only will be absorbed through GIT. So, the cases of paraquat poisoning is mostly accidental, and very rare case may be homicidal or suicidal. Sorry, may be suicidal. So in cases is mostly accidental by ingestion, or suicidal also by ingestion. So if you are faced with a patient that present and with panic because he get fear that he may exposed to paraquat, please reassure the patient that it will not be absorbed by skin or inhalation and absorbed by GIT. It has local corrosive action, okay, and produce high reactive free radical, leading to lipid peroxidation and tissue destruction. Tissue destruction starts with pulmonary fibrosis and ending with multiple organ failure. So this is the exposure to the skin, leading to corrosion in the skin, and exposure to the eye, as you see here, may lead to blindness because if it's corrosive action on the eye. Here the effect in the alveoli, leading to injury of alveoli in this form. That's followed by later on by fibrosis in that form, leading to pulmonary fibrosis in that form due to free radical exposure. Clinical picture of the patient with pain and swelling in the mouth and throat, nausea, vomiting, abdominal pain, pulmonary symptoms, cough, dyspnea, and later on there is multiple organ failure leading to renal and hepatic failure. It must be differentiated from corrosives and also from silicosis, asbestosis, sarcoidosis that may be mistaken for pulmonary fibrosis. Treatment: airway, breathing, circulation, decontamination, avoid emesis, gastric lavage, may be performed early, and may give activated charcoal. Any type of food can hinder absorption. In case of renal failure, we can use hemodialysis, and there is no specific antidote. And unfortunately, paraquat poisoning is a serious and severe case of poisoning. One of your colleagues in the previous batch asked me an important lecture. He told me that paraquat is used as rodent as herbicide in Malaysia, and he discovered that he is sprayed in the garden beside the house of the family. How can protect himself? As I told you, that the impact of paraquat is local or systemic. Local due to contact with the skin or the eye, so it's important to avoid direct contact with paraquat. But he told me the systemic long-term effect, what can occur to his body. As you know, that paraquat has toxicity due to liberation of free radical. So that patient or that person will be exposed to free radical liberation of paraquat. On the long run, the tissue, our human, Allah subhanahu wa ta'ala supplied us with mechanisms that can we deal with the small amount of liberation of free radical. But note that liberation of free radical can lead to aging, to lead to long-term effect like atherosclerosis, like a change in the color of the skin, and change on the function of the different organs. All what we can do in that case is to avoid or to minimize exposure as much as we can. This is number one. And number two, and to take what's called antioxidant. You know that antioxidant present in the market like antox or different preparation, or also some vegetables like garlic, like onion, like lemon has antioxidant properties. So this will help to solve the problem of exposure to small doses of paraquat along a long time.